Well, good morning. I am so happy to be here to help kick things off this morning and thank Linda and Chuck and everybody for your leadership through the National Council. And Steve, thank you with Cochs. What a great opportunity to bring two groups together who are having an impact and can have even more of an impact. We have a unique opportunity, I think, right now where because of a number of different factors, we have the capacity, I think, to focus on some root causes and to actually do something incredibly meaningful as it relates to people's lives, around mental health, around the criminal justice system. We have the opportunity to fundamentally change the structure. The Excellence in Mental Health Act is about changing the way we fund and view community services as being integrated, not something separate, not a little grant program that we'll try to find some money for maybe over here, but structurally part of how we are providing services. That is the goal and the vision of the Excellence in Mental Health Act. And as you know, it is way past time to have lasting changes in our sentencing system, in our criminal justice system, and the unfair, unequal impact that we have seen for way too long. So there's a number of things, excuse me, that you are talking about today, all of which I am very committed and passionate about and very supportive of. I want to speak, though, for just a moment specifically around behavioral health and the Excellence in Mental Health Act, and to ask for your help, because nothing gets done unless we commit and rev up and are focused. And you have no idea, like literally right now, as we speak, folks are on their 10th cup of coffee this morning negotiating a budget bill that we are trying to expand the funding for Excellence in Mental Health Act. So I'm going to ask you, so when you have a coffee break, I need you on your email, I need you on the phone. This literally is a very important day. Now, one of the things that I remind people all the time about, and I know the National Council does as well, is that while there is an intersection, serious one, practical one, between mental health, the behavioral health system, and the criminal justice system, when we look at mental health, it is broader than that. I mean, the majority of people who have a mental illness are not going to commit a crime. They're more likely to be a victim of a crime than they are to commit a crime. And we find people on the street or in a situation where they're homeless or in other situations where they've lost their job and so on because they're sick. They have an illness, not because they are out trying to commit a crime. And so it's very important for us to remind everyone that 1 out of 4 people every year will be in some way impacted by mental illness, have a mental illness. Now, if that was any other disease, we would have been all over it a long time ago. So this is a fundamental part of what we need to do in our healthcare system to have comprehensive healthcare. Only 40% of that 1 in 4 will actually receive services in a year, 40%. And only 11% will receive substance abuse services. And when you know the numbers, but we are seeing a public health crisis that is now leading to a criminal justice crisis, and that's where the two things actually collide. There are roughly 10 times as many people with mental illnesses who are in jails, in prisons, than there are in state psychiatric hospitals. And you know this. Of the men and women in jails or in prisons, 65% meet the criteria for substance abuse disorders. And we are seeing way too many first responders who are having to divert, thank you so much, having to divert to the treating people who should be in a 24-hour psychiatric emergency facility funded under the Excellence in Mental Health Act, rather than in the emergency room of the hospital or in a jail. And I found it so interesting that Sheriff Thomas Dart, who I'm so pleased has been supportive has said in Chicago and has called this whole crisis a national disgrace, and he actually appointed, as you know, a clinical psychiatrist as a warden of the Cook County Jail because 1/3 of the inmates needed psychiatric treatment. That is a wake-up call that we need to be very loudly proclaiming. So that's why when we proposed the Excellence in Mental Health Act, we had over 50 organizations that came together. Thank you if you were involved in one and are in this room, but the National Sheriff's Association, of course, in addition to the leadership of the National Council, National Association of Police Organizations, our veterans, Iraq and Afghanistan veterans, as well as the American Psychiatric Association and all of the other health and behavioral health organizations. So, here's the picture of where we want to be, and we have taken step one, but we have a long way to go. We have, over 50 years ago, a law in place, the Community Mental Health Act, signed by President Kennedy, that has never been fully funded, over 50 years. Now, we made a very important step forward in the Affordable Care Act. I was very proud to be the author in the Senate of our mental health parity provisions. One of the things I said as a Finance Committee is I will not, when we started this, I will not support any bill that doesn't in the end include mental health and substance abuse in every definition of health care in the law. And we have that, actually. Now, we're still trying to implement it. This is around insurance companies, and I get very concerned when I hear friends in the psychiatric community say, yes, but it's not being enforced. But the reality is, it is not legal anymore to have different copays and premiums for psychiatric care, different caps on the number of treatment opportunities, and so on. So that, in insurance, we're on the way. In the community end, this has been the challenge, right, where all of you are. And we have wonderful structures called federally qualified health centers. If you meet high standards, quality standards around preventative care or traditional, what we call health care, then the provider, the center, can get reimbursed for services, prospective payments. They can get fully reimbursed for what they do. But if they're providing mental health or substance abuse services, you haven't been able to do that. So Excellence in Mental Health Act is about creating a definition of a qualified behavioral health clinic. What are those quality standards look like? And the goal, and we will get there, it's going to take a while, but we will get there, is that in the community, if you are providing those services, if you are a certified, federally qualified behavioral health clinic, then you can do what the FQHCs can, and you can bill for service and be paid for your services. Now, this can be done together. I believe it's really important to have comprehensive services. We're not saying what the structure should look like. It can be done in combination with the health center. It can be done separately. In our state, we have a very strong, in Michigan, a network of community mental health centers that are ready to go. We have areas of the state, our state and in the country, where we have outpatient veterans clinics. We're not saying that it has to be something separate and not integrated in the community. It can be integrated however the community wants to do that, the states want to do it. The point is that we should make sure that if you're providing services, behavioral health services, you have the same opportunity to be reimbursed at the same levels as if it's any other kind of care. In other words, the healthcare system should make sure that we are treating people with diseases above the neck the same as diseases below the neck. That's the bottom line. And when we do that, and we provide more comprehensive services, then we will lessen the challenges that those in law enforcement have in the community, those in the schools and others. There are many proposals out right now, and all of which, not all, most of which I support. There's a couple, but the reality is that it's great to train our first responders or teachers and others to identify children that are having behavioral health problems. If you have nowhere to refer them, we've not done much. You know, it's great to say to law enforcement, we don't want you putting folks in the jail, but if there's nowhere else to go, it's not going to matter. So the whole point is to start with the foundation. That's why I am so focused where I am. You know, I chaired the mental health committee in Michigan back in the 80s when I was a state house member, and I was 5 years old at the time. And I saw what happened as we shut down psychiatric hospitals. There were warehousing people, and there were great concerns about that, with a commitment of community service that has never happened. Never happened. And so we've seen prison population go up. We now have more prisons than psychiatric facilities. We now have the situations in our jails, and enough is enough. So we have begun a different path. We have, when we put the Excellence in Mental Health Act together and all of the quality standards, we now have, thanks to really incredible work with Health and Human Services and SAMHSA, who went right to work on this, we now have the structure. We have the definition of what it means to be a qualified behavioral health center. We don't have to make that up. We have that now. And we know that if a community is meeting those services, what we want them to do, and the structure is there. We were not able, a year and a half ago, as we were working, Senator Blunt and I, in a bipartisan basis, very quietly while everybody else was fighting, we were over here trying to get things done. I prefer to do it that way. I don't prefer not to have everybody else fight. We'll go over here and get things done. But when we realized we couldn't get the full funding for every community to have an opportunity in every state, we basically said, okay, let's get started. How much funding, basically, would the leadership be willing to provide for quality behavioral health services? And we got a commitment for $1 billion. I could live on that, right? And we said, what does that buy? That's how we got to 8 states. People ask us, why 8 states? Because that's how much we could do, was 8 states. And so, now why, let me tell you why this is so significant though. Right now, every year we fight for a national community mental health block grant. I lead the letters, we fight, $150 million spread across the country. We have $1 billion committed for 8 states to fully do comprehensive behavioral health care. That's a big deal. Now, it's not enough. Part of what I wanted to do, though, was to create a group of states that would want to do more. And so we put into the legislation that there would be planning grants, and you know that there have been 24 states given planning grants to assess their community mental health needs and put together plans of how they could meet the standards. So we've got 24 states that have said, we're in. In fact, more than 24 applied, which shocked a lot of people. A lot of people thought there wouldn't be that many states interested. I knew, Linda, we knew, didn't we? And thanks to the council, who did an incredible job reaching out to communities and states, we had more than 24 apply. So now you have 24 states planning, assessing, saying, we want to get there, but we have funding for 8. So now we are saying fund the 24. There's actually a hashtag you can go to, fund the 24. Fund the 24. And our goal now is to get every state that has made the commitment, is planning to have the opportunity to be able to be a part of this. So then you're roughly, you're almost half the states then would be committed to comprehensive behavioral health services. Think what that would do. Then we go on to the rest. So our goal at the moment is, and I honestly don't know. We are doing everything humanly possible. My great staff, Kim is in the back who's done such great work, and Ben, we are pushing hard with your help. Again, the council's been incredible. We are seeing people engage in editorials and letters and meetings and all kinds of folks getting involved. But right now, at this moment, in the context of some very large numbers that people are talking about spending on our country's budget, on tax proposals, on other things that are being talked about right now, we are asking for $1.7 billion that would allow us to have roughly half the states in this country increasing their quality behavioral health services so that people are not in the jail, they're in either a 24-hour psychiatric emergency facility, or more importantly, getting the care that they need so they can go on to be successful citizens. These are diseases that, if managed like any other disease, can allow people to go on and be successful in life. We are losing people every day as successful, productive citizens, family members, moms, dads, husbands, wives, because they have a disease that they are not being treated for. And so my goal is to say, whether you have a sugar imbalance and you check because you're a diabetic every day and you have to take insulin to be able to manage an imbalance in your sugar, or whether you're bipolar and you have an imbalance in a chemical in your brain, it is manageable. And we should not be discriminating as to which disease you have and whether or not we're going to make sure that you have the services and the treatment that you need. That's the bottom line. So thank you for being a part of this. Fund the 24. Do at least one thing today. I want you to talk to at least one member, or okay, two. Your House member and a senator, and tell them this is the moment. And it's time to keep moving forward and actually have the kind of comprehensive health care system we want for ourselves and our families and our communities. Thanks very much.